Hello, everybody. Welcome to the interviews of the European Livestock Voice. Today, we are starting to speak about quite an important topic, antimicrobial or antibiotic resistance, and we are going to see what's the difference. And we are going to deal with this subject because we hear a lot about that, and we hear a lot of this information, many fake news circulating on this matter. Also, unfortunately, among important organizations or institutions, and we are going to speak about that with an expert who is joining us today, Nancy De Bruyn. And she will correct the pronunciation of her name, and sorry about that, but she's the Executive Director of the Federation of the Veterinarians of Europe, FVE. And so Nancy, thank you for being here, and I'm asking you first of all to introduce properly yourself.
Thank you very much. Very happy to be with you. Yeah, just to introduce myself, indeed, I'm a Belgian veterinarian. I graduated in Ghent University here in Belgium, and I've been working now for FVE for more than 20 years. Before I was a practitioner, both in mixed and companion animal practice. And my specializations have been always on the use of medicine and antimicrobial resistance and animal welfare.
So I ask you straight away the importance of antibiotic resistance, for your federation, and possibly the difference between, because I see a lot of confusion between antibiotic resistance and antimicrobial resistance, which are taken as synonymous, and they're not, of course.
Yeah, for us, the antimicrobial resistance, or even better, antibiotic resistance, is of crucial importance already for many years. We are founding member of the European Platform on Responsible Use of Medicines in Animals, and we have been promoting responsible and prudent use for many years. We're also part of many research projects to prevent animals to get sick, better biosecurity, alternatives use of antimicrobials, and also preventive strategies to reduce antimicrobial resistance. Just on your question, the difference between antibiotic and antimicrobial resistance. Antimicrobial is a much wider term. It's not only bacteria, but it also has coccidiostat, antiprotozoa, antivirals in it. But of course, the most important for us is antibiotic resistance, the resistance that bacteria get against certain antibiotics.
So antibiotics or antibiotics, depending on the pronunciation again, is part of the antimicrobials. So that's something we need to clarify already. But let's get straight to the point. So the question is, are we eating antibiotics when we are eating meat, eggs, milk, so animal origin products, or not?
No, we are not, because in the EU we have a very strict waiting period, or also called withdrawal period, set for every medicine, and this includes antibiotics. So it has been calculated how long a certain medicine stays in our body, in the body of the animal, and is when it's eliminated. So that is strictly enforced with routine testing for all medicines. So if you eat animal products, you're not eating antibiotics or any residues of other medicines.
Which is something important to clarify, because we have seen also in this last period this message circulating on Twitter and other social media platforms. So the next question is, of course, because animals are still treated with antibiotics when necessary for their own wealth on top, because it's something we tend not to consider as consumers. So like people, if an animal is sick, must be treated, sometimes only when necessary, as far as I know, with antibiotics. So the question is, can we acquire antibiotic resistant bacteria from eating meat from antibiotic treated animals or not?
Well, it should be realized that humans, animals, and our environment is one. We all live in the same ecosystem. And this means we can exchange bacteria and also resistant genes from animals to people, but also from people to animals, for example. And the same applies for food and the environment. So in principle, it is possible to get antibiotic resistant bacteria from eating meat products. However, if we look at all the ways bacterial resistance can spread, this is not a very likely route. If we look at the total burden of human infections with antibiotic-resistant bacteria, these are associated with mostly with human patients and healthcare settings. And this is logical, of course, because these are the places where antibiotic treatments has been given to people, and use of antibiotics is correlated with resistance. If we look at the risk of human resistance coming from treating animals with antibiotics, the biggest risk is for people who are in very close contact with animals, for example, farmers. But regarding food, the risk is really low, especially if good kitchen hygiene rules are followed.
So speaking of farmers, when are they using antibiotics for the animals? I mean, why and when do farmers use antibiotics for their animals?
Well, farmers use antibiotics to treat bacterial infections. Because animals, like people, they can become sick, even if they're kept under the best condition, if they have the best feeding, the best housing, still, like us, we can become sick. And even if the animals get sick, the farmer will call the veterinarian, who will come and evaluate the situation, make a diagnosis, maybe do some laboratory testing, some sensitivity testing, and then prescribe the right treatment for those sick animals. The use of antibiotics, and this is very important to know, is only allowed on veterinary prescription. And the use of veterinary medicines to compensate for poor hygiene, inadequate animal husbandry, or poor farming is banned in the regulation. It's not allowed.
So it's not used like that also because it's a cost on top, besides being...
Absolutely. Yeah, farmers do not want to treat their animals with antibiotics. They will only do it when it's needed, when there is a bacterial infection. And we all, as veterinarians, we often have a bit of feeling that the human health sector does not understand the importance also for humans to efficiently treat animals. Because if you treat an antibiotic, an animal with a bacterial disease, you can avoid that this disease spreads to other animals and spreads to people. So it is important to treat animals for animal health, animal welfare, but equally for public health.
Yeah, makes sense. You were saying before that the risk is for people staying in close contact with animals, like farmers, eventually. So, is antimicrobial resistance in humans resulting from the overuse of antibiotics in animals?
No, it's not correct, because most AMR issues in human resistance in humans relate to the use of antimicrobials in humans, which is logical. What percentage of AMR in humans is likely to be attributable to AMR in animals? Well, we don't know exactly, but if you look at all the scientific publications that have been done so far, it shows that really the percentage is fairly low, which of course doesn't mean it's not important, not at all. But for sure, the biggest burden of AMR in humans is not caused by the use in animals. It's caused by the use of antimicrobials in humans. And it's especially related to healthcare settings, so hospitals or homes for elderly people, things like that, where there are a lot of vulnerable populations together who get more sick easily and are more treated with antimicrobials. For us, it's important, we should stop this fight among sectors. We're all in the same boat. We need to work on improving our health systems, both on the human side and on the animal side, to reduce the need to use antimicrobials. And with that, that's the only solution, working together to have less antimicrobial use in people, in animals, because healthier people and healthier animals need fewer antimicrobials.
You touched a very important point, so the necessity to work together and to stop this kind of fight between sectors. So I surely don't want to get there, but as far as I know, there was a massive reduction in antibiotic use in Europe, at least, so in the European livestock these last years. And I wanted to ask you, without searching for a polemic or again a fight between sectors, but has human medicines made the same effort and reduced antibiotic use like the livestock sector has done, as far as you know, or not really yet?
Indeed, if we look at the animal health sector, the veterinary sector, there's been massive reduction. So we now have a reduction of about 43%, and we're working as a sector very much towards the farm to fork goal of 50% reduction. But what is even more important is we see in the animal health sector that we have this massive reduction of antibiotic use, but we also have a reduction of resistance. And this is the real goal, of course. We want to see resistance going down. And with this massive reduction in the animal health sector, we show it's possible. So antimicrobial resistance is reversible. Now, if we look at the human field, and there also the antimicrobial consumption is reported every year by ECDC, the European Centre of Disease Control, in what is called the ESAC-net. And they split it up in community use and hospital use, and all the reports are on their website. Now, last year they also had a decline in the human use of antimicrobials, and potentially caused by the pandemic, with more people staying at home, stricter hygiene rules, and as such less people getting sick. But overall, the reduction we see in the human use has not been at the same level at all than in the veterinary field.
So we need to work together. I take 2 more minutes of your time to ask you one thing. I take the opportunity to have you here because another myth circulating a lot still is the fact that antibiotics are used in farms to artificially promote, let's say, the growth of animals. So we know, for instance, that in Europe, growth hormones are forbidden in the cage, so since many years are not present anymore. I think they're even not produced anymore in Europe, so that's something we hope people know. But antibiotics, is it true that they're still used as a growth promotion of animals?
No, not at all. They're banned in Europe since 2006. So we're also surprised that sometimes people still say that, but it's not used at all. But there are, of course, still non-EU countries that use it. But in the EU, it's banned since long.
So thank you very much, Nancy, for your for these informations and sharing your expertise. Would you like to add some final remarks, maybe?
Well, thank you very much. And yeah, well, unfortunately, no miracle solutions exist to fight AMR and this silent pandemic. But what is important is we need to move away from oversimplification, buzzwords, and blaming other sectors. We need to fight AMR in all sectors where antibiotics are used. And we need to do it based on science. And for that, it's good that the European Union put so many DG research projects on it. Another thing is we shouldn't forget the global aspects. Diseases do not respect borders. Resistance doesn't respect borders. And we all have to do it in all sectors, so in a One Health way, because we all live in the same ecosystem on the same planet, and we only have one.
Well, I hope many can listen to you, and thank you again. Really, I hope to see you soon, to ask you soon questions again, and thank you for your time.
Thank you very much, with great pleasure.